As Nigerians join the rest of the world in marking the World Mental Health Day, the message is clear. There's an urgent need to prioritize mental health in emergencies. By doing this, psychiatrists say we can prevent long-term mental health issues, reduce suffering, and support individuals and communities in rebuilding their lives.
You're all aware that Nigeria is facing a lot of security challenges, and we have a lot of our citizens in war-prone areas. And some of them, when they have this issue related to mental health challenges, they are not able to access, you know. So going to places to increase the awareness is very important. Also making the service available, for instance, as nearest to the point of where you have the victims as much as possible. So it's quite important in that regard.
A lot of people still see mental health in terms of the madman, in quotes, running on the streets, and they say, oh no, I don't have mental health too. And they say, no, we're not saying mental illness, we're saying mental health. And so a lot of people do not know that all of us need to be mentally healthy. And mental health is not just the absence of illness, it goes way beyond that. We're talking about well-being, we're talking about being able to blossom, being able to cope with the normal stresses of life.
One of the most vulnerable people in mental health cases are young people. Their mental health has become a pressing concern globally. According to the World Health Organization, 1 in 7 10 to 19-year-olds experiences a mental disorder, accounting for 15% of the global burden of disease in this age group. Mental health experts advocate for more accessible mental health services.
So a lot of young people face different challenges, and they are exposed, they have to deal with a lot of distractions. And some of these distractions, if not properly managed, lead to them being under pressure. In addition to academic pressure that they might be going, a lot of young people still face challenges, mental health challenges that may arise due to situations that they are facing in their families.
As boys now, they tell us we're strong, we shouldn't cry, all these things. So whenever I'm sad, I talk to my dad, because my dad is someone that understands, like he has been there. So whenever I'm talking to him, he used to understand what we're going.
I used to complain to my mom that I have stress, but she would encourage me that I should keep resting and be proud of myself. In school, we have counselor that used to, if you have stress in your body, you have to go and ask her that, what can I do or what can I take for you to relieve the stress?
The challenge we're having now is the access to the mental health services. So despite the awareness, there's a gap between the awareness and the access to mental health services. So currently now, what we need to do as professionals, as organizations, as communities, we need to see how we can bridge this gap.
In a world filled with uncertainties, disaster, war, extreme stress and trauma, leading to anxiety, depression and other mental health issues, there's a renewed call for more focus on mental health care in the cases of emergencies and catastrophe. Young and old people are vulnerable, with less than 2% of humanitarian health budgets directed towards mental health services. The World Health Organization is calling for more attention to be paid to mental health care and access to mental health services. Juliet Obata, Arise News.
Well, thank you, Juliet. Now, for more on World Mental Health Day and the growing scourge of mental illness, I'm joined by Dr. Gbonjubola Abiri, a consultant psychiatrist. Thank you so much for being here.
Thank you for having me.
It's so important to make that distinction, and we heard that soundbite. Mental health is not the same as mental illness.
Definitely.
And of course, you had a young man say, boys don't cry. But I talked to my dad. So those are some of the challenges. But I'd like us to begin with the theme for this year, which is mental health in catastrophes and emergencies. How does that relate to us in Nigeria specifically? Because, we're looking at security situation from the north to the south, the economic stress nationwide, floods in parts of the country. Do all of this translate to mental illness? Are we seeing increased cases because of all of these catastrophes and, negativity?
Right, so a good place to start, like you rightly said, and like she rightly said, is to disabuse people from thinking that mental health and illness are the same thing. More often than not, the reason why people, when they hear mental health, say, no, I don't have mental health, is because of the mental. And that's largely because they think that mental connotes, colo mental, yaba left, arrow, or a disheveled man or woman on the streets.
Yeah.
But mental health is more than that. It's a complete state of physical, mental, and social well-being in which an individual is able to cope with the normal stresses of life, cope with adversity, have thriving relationships, and contribute their quota to whatever environment they find themselves. Now, to talk about, humanitarian emergencies, mental health in humanitarian emergencies, which is the theme for this year, it's particularly important to note that as humans, yes, we're resilient, we're tough, we can go through quite a lot of things. But in our difficult times and in our difficult moments, what overwhelms us is when we have overwhelming stress. So stress in itself is not bad, but when stress becomes chronic, disabling, it becomes distressing to the individual. And then enter catastrophes, disasters, and then they don't have to be big to overwhelm people. Sometimes it can be financial challenges. Sometimes it can be building collapses. It can be the insecurity that is going on in the country. It can be the big disasters like the flooding, the famine, the insecurity. But what eventually happens when an individual's mental health is at risk is whenever there is a situation or a circumstance that poses a significant risk to an individual's safety, sanity, security, and sense of stability, then that individual is put at risk of a mental health challenge or a mental health disorder or a mental illness. And so it starts to affect every day-to-day activities. It starts to affect how the individual feels within themselves, the individual's quality of life, whether or not the individual is able to interact with other people, work well. So again, it's not until the big things happen, even with all those little things, whether the individual can sleep well, eat well, interact, play with, family, friends, and do the things that otherwise they would normally be able to do. So yes, emergencies, tragedies, disasters can put us at risk of mental health challenges.
You made a comment earlier saying, we are resilient. When you hear Nigerians speak, it's like you build a wall, you push them to the wall, they rebuild another wall. And you begin to wonder, at what point should you take a break? You're resilient and tough, but at what point should you take a back seat and reevaluate? How can we do that as resilient people?
Well, so resilience is not a bad thing. And, over the years, Nigerians have also prided themselves as the happiest people in the world.
Yes.
In spite of all the challenges and circumstances.
Suffering and smiling.
Exactly. Nicely put. In spite of all the challenges and, circumstances we go through.
Yeah.
However, we should always remember to be self-aware. Know yourself. Know what your triggers are. Know what your stressors are. So again, today we had this event about burnout. And the truth is that a lot of people burn out because they don't know the limits. They don't even know themselves. They don't know when I should take a back seat and say that this is not me, what's going on with me. But what we almost always do is that we keep pushing. We keep, pushing and saying, I'll take it, another one for the team. And I think that often happens with mental health because at variance with physical health, if an individual is physically ill, you see physical health symptoms. You say, oh, I have a headache, I have a cold, I have a recurrent cold, I have pain somewhere. However, with mental health issues, sometimes it's silent. Sometimes individuals don't see it. And so people may not be able to appreciate it. They may not be able to see that it's beginning to take a toll. Unfortunately, however, what then starts to happen is that the body takes the score. The body keeps the score because the body keeps in mind that, oh, this trauma happened, and even though this person appears like they're able to show up the next day, the body is breaking down. And, I would put it very closely to what is known as the straw that broke the camel's back. More often than not, people say it and they think, oh, it's the last straw on it that broke it. But to be honest, that camel was already breaking down. And that last straw just, made everything crash.
Great. And they do say that prevention is not only better but cheaper than cure.
Yes.
But doctor, we are told that apart from you seated here in our studio, Nigeria as a whole has maybe roughly another 299 psychiatrists in the whole country.
Yes.
So when you talk about burnout and being overwhelmed, how serious is that? And what does that say about access to care?
So it's a scary situation. I would often always describe myself as an endangered species because we're not many.
Yeah.
We're less than 300. In fact, at a point, it was less than 200. And then if you look at the population of over 200 million Nigerians, it means it's less than one psychiatrist to 1 million people. If we're looking at psychiatrists, then what would happen to psychiatrists, nurses, or occupational therapists, or psychologists? Unfortunately, the brain drain is not helping. Pretty much the jackpot syndrome. Even though some people will say, oh, there's the jackpot that happened, but I don't think
perhaps not
are
as
coming
much.
back. No,
Yeah.
I don't think people are coming back. And many times people don't leave just because the circumstances are bad. They also leave because of uncertainty and because they want to be able to build something, not just for themselves, but their children as well. And so clearly that affects access to care. Unfortunately, for a condition which is already shrouded in stigma, discrimination, and a lot of ignorance, for which people are not seeking help, it further hurts the baseline. The baseline being the fact that individuals' help-seeking behavior will continue to plummet. And so unfortunately, what would happen to our patients is that they may not seek care. Even if they seek care, they may not find people to give them the care. And so what I always advocate for, especially with the work that we do at the ASIDO Foundation, is let people take the power in their hands.
Okay.
Promotive health. Again, you said prevention is better and cheaper than the cure. People need to be aware. They need to be informed. They need to take steps, daily steps, pretty much what we refer to as mental hygiene. Steps to keep their mental health in check.
Can you quickly highlight those for us as we wrap up?
So mental hygiene pretty much is similar to what is known as physical hygiene. We wake up every day and hopefully we brush our teeth and take our bath.
Yes.
And so you could do the same thing for mental health. Pay attention to your mind. Mind your mind. 10 minutes a day is enough. And so if you decide that what I want to do to pay attention to my mind is to meditate, sit down, probably listen to calm, soothing music.
Even if you're in Lagos traffic.
Yes, even if you're in Lagos traffic, and you can say that again, yes. Even if it's journaling, exercising, things that you genuinely enjoy and are adaptive and healthy for your mental health are things that we should encourage ourselves to engage in. Again, promotive health is important. Taking the power in our hands is very important, and ensuring that we are informed, aware, such that when we see the signs, when we start to notice the signs, we know that this is the time to reach out, not when we break down.
Thank you so much, Dr. Abiri, for the work you do, consultant psychiatrist on World Mental Health Day. Thank you.
Thank you very much.